I am going to discuss about the differential diagnosis of white lesion. So why are white lesion appearing white? In any condition when there is an increase in the thickness of the epithelium, mainly the keratin layer, when it increases, called as hyperkeratosis, what happens is that the distance between the superficial layer of the epithelium and the vascular bed increases and the area appears white. The other reason why the white lesion appear white are acanthosis, means increase in the spinous layer, or when there is an increase in the amount of edema in the epithelium, or when there is a reduced vascularity also, the area appears white. So these are some of the categories of white lesion, like hereditary, reactive or inflammatory, infectious, pre-neoplasia or neoplasia, autoimmune disorder, and the miscellaneous. So we'll see the most important white lesions in the oral cavity. So in hereditary, the most important is your leukoedema and white spongy nevus. And in case of reactive or inflammatory, we have frictional keratosis, tobacco-induced keratosis, and chemical burn. In infectious, we have candidiasis and oral hairy leukoplakia. And in preneoplastic and neoplasia, we have leukoplakia and verrucous carcinoma. And autoimmune disorder, oral lichen planus and lupus erythematosus. And oral submucous fibrosis comes under the heading of miscellaneous. So now we'll see each white lesion separately. So first we'll go with the hereditary. In the first case, you can see and appreciate that there is a white opalescent area in the buccal mucosa. And when you try to stretch this mucosa with the help of mouth mirror, you can see in the second picture, the white opalescent area disappears. So when it disappears, it is the pathognomic feature of leukoedema. So why there is an opalescent area is that when there is an increase in the fluid or edema in the epithelium, there is appearance of opalescent area, and when you stretch this mucosa, the fluid disappears, so that why there is no white lesion in the oral cavity. Okay, so this is about leukoedema. So the next case is, you can see clearly that there is a white area which is velvety appearance. Okay, so when you see clinically that there is bilateral white area which is velvety in appearance and it is hereditary, that is from the birth, so it can be a case of white spongy nevus. So now the second category is the reactive or the inflammatory one. In this first picture, we can see that there is a white keratotic area in the occlusal surface of the mouth. And the third picture we can appreciate in the lateral border of the tongue. So these are due to the frictions which are happening in the oral cavity, because our oral cavity is prone for friction while mastication, talking, swallowing. Every time there is a friction in the oral cavity. So when the occlusal surface erode with the buccal mucosa, in the occlusal surface of the buccal mucosa will have a keratotic line, and when the sharp tooth or sharp margin of a restoration merge with the lateral border of the tongue, there is keratosis. So this is nothing but frictional keratosis. The next reactive one, you can here see that there is a keratosis in the vestibule of the mouth. And when we ask the history, the patient gives a history of chronic usage of quitting tobacco in the vestibule. So it is a case of tobacco-induced keratosis. The next category is infectious. Here we see a white lesion in the palate. And when clinically, when you try to remove this white lesion, it gets scraped off. So it is a scrapable white lesion. So the only scrapable white lesion which is commonly occur in the oral cavity is pseudomembranous candidiasis, which is caused by Candida albicans. So it is a fungal infection and the white lesion are scraped off easily. Okay. So the next is, here we see in this picture there is a white keratotic layer in the lateral border of the tongue. Okay. So here it is called as oral hairy leukoplakia. So what is oral hairy leukoplakia? This is basically caused by a Epstein-Barr virus. It is a viral infection, and the most important point of this is it is most commonly associated with HIV patient. In HIV patient, mostly they are suffering from oral hairy leukoplakia also. So next category and the important category of white lesion is pre-neoplasia or neoplastic. So here in the first picture we see a white keratotic area in the buccal mucosa, and on history the patient gives a history of chronic usage of tobacco. and this is a case of leukoplakia. In the second case, we also again see a white keratotic area, but it appears a kind of aggressive, and when we took a histopathology, it showed a epithelial dysplasia. So it should be a case of carcinoma, and it was a case of verrucous carcinoma. The next category in white lesion is autoimmune disorder. So what is autoimmune disorder? Our own cells tries to destruct our normal cells. So in this first picture, if you see clearly, you can appreciate that there are multiple white lines which are interradiating or intersecting each other. So this is nothing but called as Wickham's striae. Okay, Wickham's striae, and this is the important clinical features of oral lichen planus. In lichen planus also we have multiple types like erosive lichen planus, reticular lichen planus, bullous lichen planus, papillar lichen planus, and the most important white lesion is your reticular lichen planus. It is completely a white lesion where you will see a white intersecting lines in the buccal mucosa. Next, again you see a erosive area which is surrounded by this intersecting lines. So this also appears like a lichen planus. Clinically, it is very difficult to differentiate, but when we took a histopathology, it was a case of lupus erythematosus. And systemic lupus erythematosus has a very important pathognomic clinical feature, that is, they will have a butterfly shaped rash in the malar region. So here you will see a butterfly rash in the patient. So that is the important feature of systemic lupus erythematosus. And the last category is miscellaneous, but the important lesion, white lesion, is it is OSMF. So what is OSMF? Is oral submucous fibrosis. It cannot be defined with the picture alone, you have to palpate also. What happens is when the patient use chronic usage of areca nut, this areca nut will increase the fibroblast in the oral cavity. So what happens when the fibroblast increases? There is increase of collagen formation. So there is decrease in the vascularity also. So the mucosa appear blanched, it appear white, it is blanched, and the vascular supply is less. And due to the collagen increase, there will be a fibrotic band which will be palpable. So that's why I said clinically by seeing you cannot appreciate OSM. You need to palpate the fibrotic band in the oral mucosa. So this is about the oral submucous fibrosis. So we have seen some of the important white lesion and how to differentiate each other. Thank you.